Ceann Comhairle, I'm here to introduce a resolution to extend the sunset clause of 3 pieces of COVID-19 legislation. Part 3 of the Health, Preservation and Protection and Other Emergency Measures in the Public Interest Act 2020, number 1 of 2020, the Health Amendment Act 2020, number 19 of 2020, and the Criminal Justice Enforcement Powers COVID-19 Act 2020, number 14 of 2020. The House will know that these acts are due to expire on this day week. They provide for a time-limited emergency powers to protect human life and public health. These are powers that this House has already passed in order to meet the significant challenges we face to date in dealing with COVID-19. We had all hoped to be well along the road to transitioning away from mandatory requirements to an approach based on public health advice, personal judgment and personal protective behaviours. This unfortunately is not the case. This vicious and highly contagious disease has once again shown how quickly it can spread. Disease incidence is high and rising. The 14-day incidence is now 668 per 100,000 population, and the 5-day average is 2,588 cases. It's rising across all age groups. We're also seeing increasing numbers in hospital, now at about 515, which is nearly 4% higher than this day last week, and in ICU, where there's currently 90 COVID patients as of this morning. We're in a place where we have to be concerned about the burden and impact that this level of disease is having and could have on our health and social care services in coming weeks and months. We are already seeing the cancellation of procedures and operations across the country, and we have to be concerned that things will deteriorate further. In its most recent advice to me, the National Public Health Emergency Team advised that the epidemiological situation in Ireland indicates a worsening disease profile with the future trajectory very uncertain. It is for this reason that Government, on the advice of NPHET, decided to extend a range of public health protective measures on a mandatory basis. This means we do need to extend these pieces of legislation. As has always been the case throughout the pandemic, the Government continues to commit to use these exceptional powers in a proportionate way. These are emergency powers directly proportionate to our emergency public health environment. Their use is confined to mitigating the impact of the disease on the public's health and are not for prolonging a moment longer than is necessary in our democratic system. They are legitimate and necessary powers that are beneficial to our society in a context where public health protection is paramount with this novel and unpredictable disease. The intention is only to use the provisions within these acts for the measures that are currently in place. For example, the continued requirement for wearing face coverings in certain settings, the use of the COVID pass and other protective measures in the hospitality and event sector. As has always been the case with this disease, we cannot predict with certainty what the trajectory of the disease will be. It is only responsible for us to ensure that we maintain the legislative powers to enable us to continue to respond as necessary and as quickly as possible. The position of NPHET is that the public health management of the COVID-19 pandemic must continue to be agile and responsive and evolve in the light of changing circumstances, risks and emerging evidence, and this will remain the case over the coming months. I would now like to provide a summary of the acts before the House. The Health, Preservation and Protection and Other Emergency Measures in the Public Interest Act 2020 allows the Minister for Health to make regulations giving effect to a range of public health measures for the purposes of protecting the public from COVID-19. The Health Amendment Act 2020 provides for fixed payment notices in respect of certain alleged offences under the aforementioned Act. The third Act, the Criminal Justice Enforcement Powers COVID-19 Act 2020, provides additional enforcement powers to An Garda Síochána to address breaches of the relevant COVID-19 regulations by businesses or services selling or supplying intoxicating liquor for consumption on the premises. I'd like to remind the House and members of the House of each of the sunset provisions in the 3 acts that are pertinent to today's debate. The original extension of the sunset clauses in each of these acts to the 9th of November was provided in the Health and Criminal Justice COVID-19 Amendment Act 2021. this House approved these extensions when it voted to pass the legislation. Members of the House will remember that I introduced an amendment to the bill, which originally provided for more than one extension of up to 3 months for each act. The amendment I introduced, and that was accepted by the House, permitted only one extension of these acts for a period of up to 3 months on the passing of a resolution providing for such extensions by both houses of the Oireachtas. After this one extension has lapsed, these acts will no longer be operational. The resolution before the House today is to provide for this final extension of the 3 acts until the 9th of February of next year. We all understand and appreciate the impact on people of this disease and the emergency measures put in place to deal with its harmful effects. I have highlighted before that Ireland is not alone in this crisis. Indeed, all across Europe and much of the rest of the world, COVID-19 has adversely impacted on societies and economies to devastating effect. We are again seeing a changing situation across Europe with rising incidents in many countries. Indeed, the measures we have decided to retain in Ireland are amongst those that other countries are now reaching for. Ireland has endured a profound shock to its social and economic life as we dealt with and deal with the impacts of the disease at an individual level, a community level, and a societal level. It's had an impact on almost all aspects of our lives, and for many, their livelihoods. Our strategy to manage the adverse impacts of COVID has been guided by an evolving understanding of the disease and its emerging variants, the impacts of restrictions on health and well-being, as well as other aspects of society and the economy. The House will know that there have been extraordinary measures introduced to protect public health and the most vulnerable in our society. These were difficult and challenging decisions in a crisis with an evolving understanding of the disease, its impact, how best to manage it, what vaccines might offer and what variants might do to undermine our plans. Members of the House will know that by passing these instruments, we are prolonging on a temporary basis only the emergency health platform from which we can deal with and manage the disease. Any requirements to extend these provisions beyond the 9th of February will require new legislation. These are not easy decisions for all of us in this House to make. They do not sit easily with us and they do not sit easily with government. And it is the stated hope of government, and I have no doubt all members of this House, that we won't have to be in a position to use the provisions in these acts any further than is currently the case. But I must again reiterate the caveat that we simply cannot know what is going to face us over the coming months. The reason we are able to keep so much open in light of such high case numbers is, of course, our vaccination programme, which continues to be a great success. Indeed, it's the envy of much of the world, with 93% of people eligible for a vaccination having come forward to protect themselves and to protect each other. We continue to see more and more people come forward, with over 24,000 new registrations recently. Our booster programme for the most vulnerable is well underway. Those who are immunocompromised are receiving a 3rd dose. Residents of long-term residential care aged 65 and above are receiving their booster, as are those aged 80 and above in the community. This week, we're beginning with booster doses for those aged 60 to 79. And last night, I authorised booster vaccines for our healthcare workers, and these will get underway either this weekend or early next week. In conclusion, Ceann Comhairle, the continuance and operation of these emergency powers maintains the potential and the flexibility to respond to an emerging COVID threat that could jeopardise public health and safety to unacceptable levels were it to go unchecked. The government must act with caution to ensure the most vulnerable continue to be protected to the best of our ability. I commend the motion to the House. Gur Mágat.